Okay, so we set the teeth and we've checked, if they're on ridge, excursives, working and non-working. Things look pretty good. So now, and both canines are moved out of occlusion again, remember, so we can see the contact, that important contact there. This guy right there. I'm going to make sure that that's nice and sucked in there. So the next thing I do is I start with the actually the mandibular anteriors. And I do this because those are the important ones to line up. Mandibular centrals, rather. Because those are the important ones to line up correctly with the maxillary centrals. And if you just start setting here, sometimes you can make a mistake in spacing and screw yourself up. So that's why I like to set these first. And the other thing is with the mandibular canines, so you can set once you set these right, you have a little bit of play with the mandibular canines. A lot of times there's a little bit of an extra space in here, but the good thing about these is you can kind of tweak them a little bit to fill up the space, and they're not really noticeable because when the patient smiles, their lips cover it, and it's not really part of their smile. So, and a lot of times, I mean, people have even done passing setups where there's been a gap in between the canine and the lateral incisor. So, but more important is the midline. So what I'll do is I'll set these teeth, basically just kind of get them where I want them, roughly, and then I'll bring this down, and I can obviously see that these are not in the right place. So what we want is eventually is this to be in line, these two lines to line up perfectly, and then also when we take it into protrusive, we want these to come edge to edge. Right now they're set too high, so it's obviously pushing them back. So I need to bring them down and kind of out. We also want, when we're done with the anteriors, we want a nice even space in here. And starting out with these is critical because you're basically setting the stage for that space. So now I'm having a hard time getting them in the right position because you also want them to be, straight up and down this way. And if I do that, these are almost edge to edge. So what I need to do, the first thing I want to do is basically take them off, and I'm going to try and grind this down a little bit more, make it a little bit thinner. If I can't, and that doesn't work, then I'm going to grind on the lingual sides of these teeth. Grinding teeth is okay, and I mean, a lot of times you have to do it, it's necessary. What you want to do is try and stay on the lingual side of the teeth. This is the aesthetic side, the buccal side, or facial side. So you want to try and grind from this side. The mandibulars are less critical because they're usually not part of the smile line. The maxillary is a lot more critical, but basically you can see if I'm trying to set these teeth like this, and they're ending up too far this way, it's because you're having interference here. So I want to grind down the bottom portion so I can flare them out a little bit more, and they're actually going to sit correctly on here. So I'm going to do that right now. I'm going to grind these away and grind this way a little bit to give me a little more room so I can set these correctly. So when they're set and they're sitting on the tooth, they're going to come, right about, maybe there. So I'm going to grind those and then we'll continue on.